This session is about commitments, actually. But one of the issues I think that comes out extremely strongly from all the discussion is that none of these, as it were, are an individual organization working on its own. It's entirely about partnership. And therefore, the commitments, it seems to me, have got to be, as it were, collective commitments. And the first of those is, in a way, a collective commitment to partnership. It's not a question of donors versus recipients. It is actually, as you put it, development partners. The data has got to be, again, it's a shared commitment, isn't it? It has to be in country. There has to be the desire to know about vital registration. So that, again, is not something that can be done on its own. Just going back, I think that there's quite a strong sensation. There needs to be a very strong commitment to developing more sophisticated models of tiered pricing. Another one I think is coming out is a commitment to working more closely with the regulators. It's not them versus us. Regulation is a relationship between someone that's producing something and the regulator. So again, there's got to be a shared commitment to working on this. And it seems to me that the time is ripe for all of these.
We shouldn't view, academia and pharmaceutical companies as two buildings in front of the same street. I think we discussed a little bit earlier, we need to connect much faster than what we do. And I think we are doing it too late. In the early phase of basic science, I think it's extremely important that we connect with our R&D guys from the start, from the selection of the targets, from the regulatory constraints. We all know that there are some vaccines candidates or drug products that could have some medical value, but are extremely difficult to develop from a regulatory standpoint. So I think the sooner we can connect, the better it will be. And I think also it will have some influence. There are a lot of money, although probably not enough, but in R&D today. But there are also, let's be honest, also a lot of waste. So one of the critical issues is to make sure that we leverage everything we spend. And here, I think it should be our common mutual interest.
I think the greatest gap is not on the basic research side, which is pretty well funded, and we've seen extraordinary advances. It's in the translation of that basic research into products. And for that, we need slightly different mechanisms. So a whole new class of organizations have been set up, product development partnerships across a range of diseases. There's 120-odd products now in development coming out of those, some of them using very new science, some of them using old science. And I think the challenge is how we fund those, how we set a sustainable funding up to make sure that pipeline continues. And Chris Elias has talked a lot about the innovation pileup that's going to occur, and we've got to deal with how do we get these through testing, how do we move them into ultimately what's going to happen. But I think when they get to that point, the basic research is there. As I said, we can always use more. But the other side, if you come to the companies with a product, you've taken out the risk now. If there is zero market, it is a problem. But if there is some shared market, they will pick it up. The issue is they may not start at the beginning, which is something they used to do. But the timelines have gotten longer, the risks have gotten higher, it's more expensive.
I think from our point of view, from public health workers, I think we have to deal with the different sectors, with the government, with the industrial, with the public, which is the children and the parents, and also with some organizations like the WHO, like the foundations. We have to work together. For the industrial, we don't want to have a very low price. We give extremely the sample yesterday I talked about. This year in China, we buy the vaccine for hepatitis B virus. We use the 1 RMB for 3 doses. So such low price, we are worried about how the industry to adapt the new technique, to change the old vaccine. Some is already has a 30 years old, 40 years old technique. The technique, the biotech already exists. How to adapt into our vaccine, the research and protection to give the public the new vaccine more safer, more easy, and more convenient to deliver.
I think you raise an extremely important point. It's about data. If I tell you more than 80 countries in WHO, they don't even have birth and death registration and have causes of death. I mean, system to account for that. So what are these countries and development partners through their ODA investing in? So I believe what gets measured gets done. We need to start, go back to basics. Many of the development partners, including UK and others, are beginning to ask for results, accountability. That's extremely important. No parliaments in any country would like to invest to support other countries if they only see money going in, they do not see results. So the kind of impact you're talking about is extremely important. And we also, the public health community, need to do a much better job in terms of not just saying, oh, we immunize 250 million people, we prevent 400 deaths. So how do those things translate into economic development? We need to do research in the delivery and the health system. What works and what do not work? What are the synergies and where are the co-benefits when we integrate things together, get the quality data to reinforce the policy formulation, and then to help policymakers to make investment decisions.